the suicide rate among women in America is skyrocketing. If it feels like you've been hearing sad stories of suicide on the news a lot more lately, it's because, unfortunately, you have. According to some troubling new research from the National Center for Health Statistics, suicide rates are experiencing a steady rise, bringing them to a 30-year high in the United States. That's not the worst of it, though among women, those rates are disproportionately skyrocketing. Overall, the national suicide rate rose by 24% from 1999 to 2014, a stat that's scary enough on its own. But drilling down into the demographics paints a more dire picture. The number of women ages 45 to 64 jumped by 63%, while the suicide rate among young girls talking ages 10 to 14 rippled. The leading cause of death among women? Poisoning. Until 1999, the overall suicide rate in the U.S. had been on a steady decline, but just before the turn of the century, the trend flipped and rates started rising. So why are we seeing such an increase? Experts hypothesize that rising job stress and a struggling economy, as well as declining marriage rates and rising divorce rates, likely factor big into the suicide rate for middle-aged Americans. Meanwhile, in a 2015 report, experts at the Centers for Disease Control and Prevention stated, a data coverage that provides details about suicide methods has the potential to increase contagion among vulnerable youth. When it comes to young women in particular, experts theorize that the rise of social media including online bullying could be at play. Now with the use of social media, social interaction is happening online. There are stressful situations like cyberbullying, which is a stress factor and can worsen depression. Maria Oquendo, MD, a psychiatry professor at Columbia University Medical Center, tells NBC News. That's one thing that may be contributing. And there are studies that back up that idea. Previous research from University of North Carolina's Gilling School of Public Health found that social networks had significant effects on suicidal thoughts in teen girls. These stats are obviously depressing, but we're hoping that getting a conversation going will make people understand that this is a public health crisis that seriously needs to be addressed. If you or someone you know is considering suicide, please contact the National Suicide Prevention Lifeline,